Hi. All right, so today we are going to talk about men's health, and specifically we're going to focus on prostate health. So a little bit of anatomy first. Okay, so your prostate is a gland that is located between your bladder and your penis, just in front of your rectum. And your urethra runs directly through the center of your prostate. Okay, so keep that anatomy in mind because now you're going to know what it impacts. So when your prostate becomes enlarged, you may develop a variety of different types of symptoms. Before I get to the symptoms, a little bit about prevention. So, for men who have developed prostate cancer, only 1 in 41 men who have developed prostate cancer actually die from prostate cancer. So keep this number in mind because it is a very preventable and very treatable form of cancer in men. Now that means that you need to get tested early, and work on preventative medicine because you can actually prevent these issues from happening. Benign enlarged prostate is kind of an inevitability. Eventually, as you age, especially if you are of advanced age, you're going to eventually develop an enlarged prostate. It's part of the aging process. Our concern is usually if you start developing those symptoms earlier on in life. So, usually once you reach your 50s, your medical doctor is going to suggest that you start getting tested regularly for prostate health. If you are in a risk category, for example, if you're African American, you do have a higher risk of developing prostate cancer. So your physician may advise that you get tested earlier, like in your 40s. And if you have familial risk, in other words, men in your immediate family have had prostate cancer, then your medical doctor is going to advise you to get tested early as well. So usually again in your 40s. So what does the prostate test involve? Well, it's usually a digital test. So your physician will insert a gloved, lubricated finger into your rectum, and then they can palpitate the prostate. So they can feel the outer surface of the prostate. They can tell if it's inflamed or if there are any growths on the outer surface. The second type of test that may be done is they're going to do a blood test that's going to test for something called PSA, which is called prostate specific antigen. All right. And if that antigen level is elevated, then that may indicate that you have a benign enlarged prostate. Now, if there is a concern that you may in fact have prostate cancer, there's a third type of test that may be done, and it's a prostate ultrasound. So an ultrasound device is inserted into the rectum, and they may actually also insert a needle to do a biopsy. So the biopsy is going to take some tissue from the prostate, and then that tissue is going to be tested for cancer cells. All right. So your regular test is most likely going to be a digital exam. If you have risk factors for prostate cancer, then your physician may advise you to get both the digital exam and to get the blood test for PSA as well. Okay, so keep in mind you have options when it comes to prevention to protect yourself from cancer. It is a very treatable form of cancer. Only 1 in 41 men die from prostate cancer. So be addressing this issue and get ahead of it. All right. So what normally causes benign enlarged prostate? Usually it's a type of testosterone. It's called DHT, dihydrotestosterone, and it collects in the prostate tissue and causes the prostate tissue to become enlarged. And then it impacts your urethra. Remember, your urethra is running right down the center of your prostate. So your urethra carries urine and ejaculate as well, seminal fluid. Symptoms that you may have a benign enlarged prostate can include frequent urination, especially at night. So you have to get up often during the night to go to the bathroom, then your prostate may become enlarged. Straining when you have to urinate may mean that your prostate is enlarged. Also not having a good flow, so dribbling or having an incomplete flow may also indicate that you may have a benign enlarged prostate. And then ejaculation issues can be as a result of benign enlarged prostate, because remember, it could be putting pressure on that urethra and interfering with ejaculation as well. All right, so keep in mind, if you do have benign enlarged prostate, Try and avoid the over-the-counter decongestant medication and antihistamines as well, because they can exacerbate your symptoms. So keep those two things in mind. Now, there is a prescription drug that is used for treating benign enlarged prostate. I'm going to tell you what the side effects are, though, because we are going to talk about some natural options following this. So some of the side effects of the prescription drugs for benign enlarged prostate can mean a reduction in sex drive, ejaculation problems, also sex drive and libido is affected. So again, it's going to interfere with quality of life. And then also enlarged breast tissue can become an issue, or sensitive breast tissue. Okay, so those are some of the side effects or possible side effects you can experience from taking the prescription drug for benign enlarged prostate. So let's talk about natural remedies. We're going to talk a little bit about foods first. Pumpkin seed oil. All right, so the Flora company does a certified organic pumpkin seed oil in beautiful glass amber bottles, and they don't need to be refrigerated. You can incorporate pumpkin seed oil into your diet. You can even cook with it. It's stable up to a certain temperature, so kind of a low temperature cooking. You can add it to your salads. Well, why would you want to do that? Well, pumpkin seed oil is high in zinc. Zinc is the mineral that's very important for maintaining healthy prostate tissue. Okay, pumpkin seed oil also helps with regulating DHT, that type of testosterone that can cause benign enlarged prostate. It also has anti-inflammatory properties to it, so it's good for prostatitis, which is an inflammation of the prostate. All right, so incorporate some pumpkin seed oil into your diet. The second oil that I would recommend is borage seed oil, and you can get that in a capsule form from the AOR company. It's a Canadian company. Or evening primrose oil, and that's available as a brand called Ephemal that has a really well researched, standardized, good quality evening primrose oil. Okay, so what do these two plants or flowers have in common? These two flowers contain something called linoleic acid, gamma linoleic acid, and it has anti-inflammatory properties to it, and it helps with the frequent urination issue. All right, so you can incorporate that into your supplement regimen. Now, borage seed oil and evening primrose oil are actually heavily marketed towards women. So if you go into a health food store and you see lots of pink labels, or if you see beautiful skin and all those types of claims on the label, yeah, they're good for those things as well. But don't be afraid of buying the product just because it's marketed towards women. It definitely has benefits for protecting your prostate from inflammation. Okay. All right, so let's move into some of the herbals. Well, technically this one's not a herbal, it's sourced from a fruit. Lycopene. Lycopene is an antioxidant that's found in really high levels in tomatoes, specifically cooked tomatoes. So, your pasta sauce, your tomato sauce. When you cook tomatoes, it frees up the lycopene in a digestible form. And lycopene is anti-cancer for the prostate, okay? So it can prevent cancer cells from developing or proliferating in prostate tissue. So you can get it in a supplement form, or you can incorporate it into your diet using, as I said, tomato sauce or pasta sauce. Okay, I'm going to give you a little bit of a list of some of the herbals that are strongly recommended for prostate health. And then at the end, I'm going to give you some suggestions for some brands that incorporate all of these herbals. All right, so rye flower pollen extract. So that one has been researched for helping with relieving inflammation in the prostate and also helping with good urinary flow. Keep in mind, you want to make sure that you're clearing your bladder when you urinate, because residual urine in the bladder can cause irritation, inflammation, and in some cases increase your risk of infection. So it's important to have good flow, and rye flower pollen has been researched to show that it helps with improving the flow and also reducing inflammation. Saw palmetto berry extract, fabulous ingredient. There was actually a research study that was done in Switzerland, and they did a comparison between saw palmetto berry extract and the prescription drug that's most commonly recommended for benign enlarged prostate. They had similar results, but the benefit was that the saw palmetto berry extract didn't have the same side effects as the prescription drug did. Okay, so keep that one in mind as well. Very good option. All right, next on our list is something called maca. And maca is a Peruvian ginseng, and it helps with sex drive, it helps with ejaculation, it helps with regulating your hormones, especially it's an adaptogen, so it helps with regulating your testosterone levels and your cortisol, so your stress hormones, so you have good healthy balance, and so you don't have elevated levels of DHT. So you want to see maca in some of your prostate formulas. All right, so those are some of the herbal remedies that I recommend. So there are a couple of brands that incorporate these ingredients. Number one is the Canprev company, and their product is called Prostate Pro, and that one has a nice high level of maca. So if you find that you have these prostate symptoms and also your sex drive is being affected and there are ejaculation issues, then you may want to consider using the Canprev company. So their dose recommendation is 2 capsules twice a day. So you maybe take 2 with breakfast and 2 with dinner. All right, so that one's a nice easy one, and it incorporates some of those other herbals I mentioned earlier. Okay, the other brand I like recommending is the New Roots company, which is also a Canadian company, and they have a product called Prostate Perform, and that one is a 1 or 2 capsule a day dose, so a little bit easier for you guys who have trouble remembering to take something more than once a day. So normally what they suggest is that initially you start out with 2 capsules a day, and then once you start seeing a reduction in your symptoms, then you can transition down to 1 capsule a day for maintenance. Okay, so those are 2 really good formulas that you may want to consider incorporating into your supplement regimen, especially if you're in your mid to late 40s, and especially if you're starting to see some symptoms happening. Okay, so protect and prevent. I hope that this video was helpful. If you did find it helpful, don't forget to click the like button, subscribe, and don't forget to hit the notification bell so you'll know when next I post a video. Thank you so much for listening. I really enjoyed chatting with you. Have a wonderful day and keep well.